Ossifications at what age it will occur around wrist, elbow, sternum, suture, skull sutures will be discussed. Elbow, we know famous mnemonic crito. It is capitulum, radial head, internal epicondyle, trochlea, olecranon, and external epicondyle. Capitulum, radial head, internal epicondyle, trochlea, olecranon process, and external epicondyle at the age of 1, 3, 5, 7, 9 and 11 years respectively. Coming to wrist, we know she looks too pretty, try to catch her mnemonic. Start from capitulum and exclude pisiform and go spirally. That is capitate, hamate, triquetral, lunate, scaphoid, trapezium, trapezoid, pisiform. Starts from capitate, CH, T, leave pisiform, then lunate, scaphoid, trapezium, trapezoid. Then pisiform will come, and then first metacarpal, then ulnar, then radial. Age will write. Capitate 2 months. Rest all will be at years. 2 year, 3 year, 4th year, 5th year, 6th year, 7th year. By 8 year, 8 to 12 years, pisiform would have formed. First metacarpal by 15 to 17 years. Styloid process of radius. So ulna will be first, then radius will occur. Ulna will by 17 to 18 year, radius by 18 to 19 year. Okay. Now fontanelles, we have in the child anterior fontanelle, posterior fontanelle, sphenoid fontanelle and mastoid fontanelle. All fontanelles would have been closed by 6 months, usually between 3 to 4 months would have closed, but anterior fontanelle will close at 2 to 3 years. Then we have sutures. Before that, bones will be named. This is frontal bone, this is parietal bone, temporal bone and occipital bone. This in between the two halves will be sagittal suture. This is coronal suture. This is lambdoid suture. In front we have metopic suture in child. Metopic suture will close first by age of 1 year or average of 2 to 4 years. Then below spheno, this is sphenoid bone. Spheno and occipital suture will have closed by 18 to 24 years. Then from back to front, lambdoid, sagittal and coronal. Lambdoid at 45 to 60 years, sagittal at 50 to 60 years, coronal also at 50 to 60 years. Then parotid with mastoid will be at 55 to 70 years. Parotid with temporal will be at 60 to 70 years. Then pterion, all these 4 sutures together, pterion at 65 years. Important thing is inner table is closed first, then after 5 to 10 years outer table will close. Okay, now we have manubria and sternum. Clavicle to manubrium will be joined by 21 years. This sternum body parts will be fused at 15 years, 20 years, upper will be 25 years. Between xiphoid and sternum, it will be by 40 years fusion. Then manubrium to sternum, late, almost some 60 years. Then we have pelvis bone. Appearance and fusion both are different. Appearance of head of femur will will be by birth. 1 year it would have in 1 year it would have been appeared. Then greater tubercle by 4 years, lesser tubercle by 12 to 14 years, tri-radiate cartilage at the acetabulum by 13 to 15 years, iliac crust by 14 years, ischial tuberosity will be 16 years. Fusion of these structures, all these three, head of femur, greater tubercle, lateral tubercle, fused by 17 to 18 years, tri-radiate cartilage by 15 years, iliac crest by 18 to 20 years, ischial tuberosity by 20 to 21 years. Then sinus pneumatisation. We have 4 important sinus in our facial skull. At birth only ethmoid suture will be formed. Ethmoid sinus would have been formed. Maxillary sinus will by 4 years pneumatisation. Sphenoid sinus pneumatisation, it only develops only at 5th year only. Then frontal sinus develop at 7 to 8 years only. Now at what ossification, usually before birth we only have primary ossification, then postnatally we have epiphyseal secondary ossification, but some structures have secondary ossification at the time of birth itself. They will be head of humerus. Then in leg we have sacrum, lower end of femur, upper end of tibia. Then we have ankle joint. In foot we have talus, calcaneum and cuboid. These have secondary structures, ossification structure at birth only. Talus, calcaneum and cuboid, not cuneiform, cuboid. And at what age you should do which X-ray is preferred for identification of age? At age group of 6 to 12 years, preferred is elbow and wrist X-ray. Then 13 to 16 years, preferred will be elbow and pelvis X-ray. 16 to 17 years, ankle X-ray is preferred. 17 to 18 years, hip X-ray is preferred. 18 to 19 years, knee, shoulder and wrist X-ray is preferred. Then 20 to 21, again hip X-ray is preferred.